When it comes to prostate cancer treatment, one of the top concerns men and their loved ones have is in regards to their urinary control. Some of the common questions include, will I be leaking urine after undergoing prostate cancer treatment? How can I regain this urinary control? Well, we have these answers and more today in our interview with Dr. Daniel Kirages, an interview you won't want to miss, so stay tuned. So the big question is this: how can men and those who care for them better educate themselves regarding prostate health, the conditions that affect the prostate, and the latest technology in managing these conditions? That is the question, and this podcast will provide the answers. On a weekly basis, we will be chatting with experts, innovators, and leaders in the field of urology, sharing useful information with the general public to improve their lives and increase their overall health. My name is Dr. Garrett Pullman, and welcome to the Prostate Health Podcast. Prostate Health Podcast is for informational purposes only. Nothing in this podcast should be construed as medical advice. By listening to the podcast, no physician-patient relationship has been formed. For more information and counseling, you must contact your personal physician or urologist with questions about your unique situation. I'm very excited to bring to you an expert when it comes to pelvic floor exercises in regaining urinary control following surgery for prostate cancer. Dr. Kirages is the first doctor of physical therapy to be joining us on the Prostate Health Podcast. He is an associate professor of clinical physical therapy at the University of Southern California. In his clinical practice, he attends to a diversified patient load, including various pelvic health disorders. You can also find him lecturing at a variety of academic institutions and healthcare facilities nationally and internationally. He is also a member of the Clinical Practice Guidelines Development Panel for Incontinence After Prostate Treatment for the American Urologic Association. Dr. Kirages, welcome to the Prostate Health Podcast.
Oh, thank you. This is wonderful being here, Dr. Pullman. I really appreciate the opportunity to chat with yourself and your listeners.
Well, I thought it would be helpful to our listeners if we could first review, why do men initially have urine leakage after a prostatectomy for prostate cancer?
That's a great question to start with, Dr. Pullman. Well, there are really three potential reasons in the literature. The first and probably the most responsible is something called sphincter deficiency, which means that the muscle at the base of the bladder is not functioning well as a plug. Another reason is something called detrusor instability, which is the muscle around the bladder, or the pusher muscle, for example, is a bit too active at times in creating some pressure around the bladder. And this can be due to the insult that the bladder went through during the surgery, and maybe the bladder is a bit angry and creating some of that instability. The other and the last is the reduced bladder compliance, which is the bladder somehow has become, maybe, can we say, a little stiffer and is not expanding like it used to, which reduces the volume that it can hold. But I'd like to expand a little bit about the sphincter deficiency reason.
Sure.
And with an undisturbed urinary system, there are two sphincter mechanisms that allow bladder control. An involuntary muscle called the internal sphincter, that's the one that maintains closure of the bladder right at the opening near the top of the prostate gland. And then there's another muscle below the prostate gland, that's the voluntary sphincter, which means we have control of that. That's the external sphincter, or even part of this larger muscle called the pelvic floor, which is what we're talking about today. And that maintains closure of the urine tube called the urethra as well. So during a prostatectomy, this natural defense to leakage is disrupted. The surgeon carefully dissects the prostate gland away from the bladder and the internal sphincter. But unfortunately, sometimes this internal sphincter is damaged and may not function as well after the surgery. Actually, some urologists have told me they feel that most of the sphincter is gone, and others say we try to preserve as much as possible, which is true. But either way, the internal sphincter, which is that involuntary one, is not going to be functioning as well as it did preoperatively. So, the trauma of the surgery, the internal sphincter being damaged, and the internal catheter, which is the artificial urine tube put in through the urethra, have left this pelvic floor muscle, which is our voluntary one, in a state of shock. And at this point of recovery, the pelvic floor muscle is not able to perform its job efficiently. So it becomes lazy, becomes weak and uncoordinated. And when the timing is off, it needs to be training. So our body does a nice thing of helping us with healing. When a muscle goes through some trauma or there's trauma in an area from a surgery, our nervous system tells the muscle, hey, let's shut things down. That's great for healing, but it's not very good for function. So after the prostatectomy, that voluntary pelvic floor muscle is left in this state of being inhibited by the nervous system. And therefore, once the catheter is removed, which is usually 7 days after the surgery, then the muscle is not ready to do what it's supposed to do, which is maintain continence.
Well, I think that was an excellent description. And I think that's what makes, treatment for prostate cancer, and with surgery being one of those options, difficult for men to navigate, because certainly a quality of life issue. And when we start talking about urinary incontinence, so what can men do to help regain their urinary control after the prostate removal?
So how do we help a poorly functioning muscle work again? And the answer is rehabilitation. I mean, time takes care of some of the natural healing of tissues, but there needs to be some other intervention to occur to try and help a muscle restore itself back to its prior level of function. If I can use an analogy, and this comes from the orthopedic world where rehabilitation is synonymous with the word surgery, is if someone has a knee surgery, usually the thigh muscles, the quadriceps, go into inhibition, and therefore they need some time and exercise to recover, to get someone to have a stable lower limb so they can walk again without a brace or an assistive device. So in this situation after prostatectomy, it's important for the pelvic floor muscle to go through a state of rehabilitation or a process of rehabilitation to try and get back the control. And in the intro, you mentioned the clinical practice guidelines for incontinence after prostate treatment from the American Urologic Association. And that document recommends that clinicians should offer pelvic floor muscle training after prostatectomy. But there are also some other little helpful tips and advice to offer as well. And not only should someone perform their pelvic floor muscle training program, but it's also very important for them to use their muscle actively during life and retrain the timing of when the muscle is supposed to be turning on. And to do that, to retrain that timing, we have to do something called an anticipatory contraction. So this means contracting your pelvic floor muscle just prior to an event that might cause incontinence. So that's usually associated with an increase in abdominal pressure, like a sneeze, a cough, standing up, a quick movement, something that increases abdominal pressure where your abdominal muscles turn on, push on the bladder, and then the urine leaks because that sphincter underneath is not competent enough at that moment. So training them not just with the exercise program, but how to utilize this muscle during regular activities of life to retrain the brain and that muscle to have it start kicking in at the times when it should be. Remember, it's a bit lazy and turned off now by the nervous system, so that needs to be retrained. It's also important to help those post-prostatectomy to understand the importance of still maintaining normal fluid intake. Sometimes they have this idea of, I leak, therefore I don't drink. And that's not great either, because that could create some non-diluted, concentrated urine. And, in some people, that is bothersome to the bladder. And if, again, they're trying to keep their bladder environment somewhat quiet because they're still trying to improve their sphincter, if the bladder is turned on a little irritated, that creates more pressure. Therefore, that might also increase some of the incontinence that they're experiencing. And the last little quick note on this is some education and helping people realize that certain fluids, let's say alcohol, for example, might make the muscle a little lazy also. So it's not everyone is sensitive to it, but there are those patients who say, I'm usually about one protective pad or undergarment a day, and then had a couple glasses of wine. I was out with some people, and then, wow, good thing I had an extra pad in the car because that created a little situation for them. So that's just an education piece, but primarily it's going to be the exercise component.
So, you kind of mentioned, not only the doing the exercise itself, but the timing. But again, so how do these pelvic floor exercises help in regaining that incontinence?
No, the goal is to reduce the deficiency of the sphincter. So that'll happen with uptraining of the muscles to provide a more appropriate closure at the base of the bladder. But as we mentioned before, it's not just about strength. It's also about endurance and that timing as well. So the pelvic floor muscle must be able to maintain closure at the base of the bladder while someone's moving around, like walking, running, but it also has to kick in to give a quick, forceful support with an increase in abdominal pressure, like we mentioned, the cough or sneeze. So really, it's just training that muscle to provide better closure at the base of the bladder at all times. The pelvic floor muscle is working constantly, which is why we're continent. And in a normal situation, we decide when we eliminate or void our fluids. Our body might tell us, hey, it's time to go, but we can hold or we could go. And so it becomes definitely a quality of life measure when we lose control of that particular function.
So in relation to timing of the surgery, when should men start performing these exercises?
So exercises for the pelvic floor muscle are easier to learn in the preoperative period, since mastery can be difficult sometimes postoperatively given the muscle inhibition, maybe some sensory changes in the area, the incontinence itself being present, and in some folks, surgical pain. Usually prostatectomies aren't that painful, but there could be in some. So the goal is to educate the patients and help them establish that awareness of how to perform a proper pelvic floor muscle contraction. And the benefit of pre-op exercises in the literature shows some inconsistent outcome data for the pre-op. But some show effectiveness in recovering continence faster after surgery, and others not as much. But the overall quality of the studies can be improved with some better research methods. But however, it is important to note that formal pelvic floor muscle training is not harmful, and the potential benefits clearly outweigh any potential risks, and likely will decrease regret for those who do exercise preoperatively. But for those that have not exercised preoperatively, pelvic floor muscle exercises at any time postoperatively can be helpful. I've had patients where they've called me, maybe they're about 6 months postoperatively, and I hadn't seen them before. And they say, I'm interested to know if you think pelvic floor exercises will be helpful for me. And so I asked a little history. And I said, well, have you performed any pelvic floor exercises in the past? Like, what has happened since your surgery? And they said, well, I was given a little exercise sheet as to do some squeezes of my anus or something like that. I never really did them very well. I'm not even sure if I was doing them correctly. And I just decided that, I just wasn't good about my exercise program. And they're at the 6-month mark. Let's say they're still wearing 3 protective undergarments. For that person, pelvic floor exercises, I think, would be great. Even at that moment, postoperatively, let's start something. Yeah. Let's get that muscle to start to rehabilitate. On the other hand, similar scenario, I've spoken to patients where they've asked me if I think pelvic floor exercises would help them. And then when I asked them about their history, they said, oh yeah, I went through a whole program. I was already working with somebody and it helped me, but I think I'm still bothered by my incontinence. For that person, because they've already been through let's say a quality program already, I don't think the exercises to restart would necessarily be that effective. I think they would work towards visiting a urologist that would help with other options outside of the conservative care measure. But exercises can start at any time if someone has not already been through a program that would be considered quality or that they had been committed to.
Well, I think those are all great points. And, in my practice, I kind of would tend to agree with you in terms of, if they can do some of that training before the surgery, they kind of just hit that ground running. When they get the catheter out, they've got they're worrying about other things, lifting restrictions, recovering. And so if they got one piece of the puzzle kind of, already learned and they're on board with it already, I think that kind of helps. Sometimes I feel like it speeds up the process, but I think another great point in that if they haven't done that, it's not too late to start in certain situations. So, and that kind of leads us into the question, how long does it typically take for men to regain their urinary control after a prostatectomy?
If we started that time clock right after catheter removal, most of the studies would look at a 1 year time frame, like that's frame that they're looking in. And so within that time frame, most men will regain their control within a window of like 3 to 7 months. Now that's a big window, but there's some people who are superstars, right? In like 4 weeks, they're like, hey, I bought all these pads, didn't even really have to use them. And they want to give them, hey, can you use these? They want to give them to the clinic, because what do I do with these? And that's wonderful that there are people like that. And then there's some who have improved their continence over time, but now they're at 9 months, 10 months postoperatively, and they're still bothered by the incontinence. Maybe they've gone from initially wearing 4 or 5 protective undergarments and now they're like 1 or 2, but they're not fully continent. But yeah, it's that 3 to 7 month window when most people gain their control, get back to where they want to be, which is fully continent. Now, interestingly, some of the research studies, they measure continence by being 1 pad per 24 hours, which means, and I was part of one of these meetings before, and it was like, well, that's not back to the preoperative status. And they say, well, it's like wearing underwear. They don't have to change it. And then other studies, and most of the studies are like no pads, back to normal. So, and looking at the literature, there's some challenges of deciding what is their definition of continence. And because those differences do occur, it requires some interpretation.
Definitely. Now, when you're counseling these men, how does one find their pelvic floor muscles so that they really know that they're exercising the correct muscles when doing these Kegels?
So the pelvic floor muscles are basically around the anus and around the base of the penis and everything in between. So in helping men to find these pelvic floor muscles, there's some verbal cues that could be very helpful. There's obviously in the clinic, we can visualize them, we can touch them, we can palpate the muscles externally, we can do an internal exam to have them squeeze their anus around, let's say, our finger to help them. But that's like in clinic. Let's say, can we teach someone how to perform a pelvic floor muscle exercise, let's say over the phone? Can that be done, right? So that would be the ideal way to do it. But in terms of the verbal cues, and someone like your audience here today who's not sitting in front of us on a treatment an exam table, we could say that we should help them get a sense of pelvic floor muscle activity by maybe first starting at the base of the penis. And can they contract the muscle at the base of their penis as if they're making their penis move, or like they're pulling their penis in? Another analogy could be if you were urinating and wanted to stop your stream of urine, can you make that happen? And if they can stop their stream, then they have activated those particular muscles that are necessary. Now, I know historically, many, many years ago, that used to be one of the exercise suggestions, was stop and start their urine stream as an exercise. That's no longer. Now that could be used as do it once or twice as a form of feedback to help them understand if they're contracting the proper muscle. The other thing, too, that all men do is when we urinate, sitting or standing, we're urinating into the toilet. And then once the stream is pretty much done, we have to contract our pelvic floor muscle 3 or 4 times to clear the line because there's urine still within the urethra. So all of us pretty much contract our pelvic floor muscles right after urination so that we don't dribble, because if we didn't, there would still be some urine that exits. Ejaculation is another place where this pelvic floor muscle is utilized. So sexual climax. So if someone can get a sense of when they've had sexual climax and ejaculation, what muscles were working that were actually pushing out the ejaculate. So those are all anterior cues, stopping the urine stream, contracting to move the penis. And those are very good to have in mind because that's more anterior where the urinary sphincter is. Now, posteriorly, that's also part of the pelvic floor muscle. So that's contracting the anus as if holding back gas, or if someone had, let's say, a finger in the anus, you're squeezing against it. So both those front and back visuals are important for someone to learn how to control and contract the pelvic floor muscle properly. And that awareness is the main event of pelvic floor muscle exercises. They also have to know what not to contract or what to pay attention to avoid. And that's holding their breath or bearing down like they're pushing or contracting their abdominal muscles. Some people will squeeze their gluteal muscles, their buttocks. And we want them to recognize that it's more subtle than that. It's more internal than that. And it's right around just that anus and base of the penis region, which is where they want to focus their attention. Now, when we get into maybe discussion of exercises, we do have men contract their pelvic floor muscle and then incorporate some other muscle groups to assist as well. But that's later. At first, it's establishing that awareness of that beautiful localized contraction, which is necessary.
So I know a lot of men are really focused on trying to do everything possible to get to that point where they're down to not wearing any pads anymore. Now, have you seen any trouble with men going above and beyond doing more repetitions than what was recommended to them by their physical therapist?
I would say rare, but yes, I have. And what might be noticed is you mentioned is, maybe that too much might cause some fatigue in the pelvic floor muscle, and maybe that might increase incontinence or leakage temporarily. So that's an easy fix, though, to have them just reduce the dosage of the exercises and not be so overzealous. But since we are really after what's called neuromuscular re-education, lots of reps are usually tolerated. Remember that they had a fully functioning pelvic floor muscle prior to surgery. And then now the nervous system has told it to quiet and chill out for healing. So neuromuscular re-education does require lots of reps to try and reestablish some of those neural connections. In speaking to providers who do pelvic floor muscle training, it's important to have them realize that this post-prostatectomy group is different than, let's say, pelvic floor muscle exercise instruction for, let's say, a 70-year-old female postmenopausal where estrogen levels are lower, where their pelvic floor muscle might be very thin and atrophied, and they could fatigue very easily, where this group is more of the neuromuscular re-ed group. So by having them do the exercises, quite frequently, is sometimes more beneficial. But you're right, we do have to pay attention to make sure that they're not doing too many, which would then prevent the muscle from actually going through its recovery period, which is where some of that muscle building happens or that re-education happens.
Now, for our listeners with prostate removal for prostate cancer, men will typically, as you'd mentioned, have a catheter draining their bladder on average for about 1 week. Again, this catheter is a small flexible tube that drains urine from your bladder through the penis and out to a drainage bag. Another common question I get is, should I do the Kegel exercises while I have a catheter in place?
I would say no, because as the catheter's in place, the purpose of it, right, is to allow the healing to occur where they've connected the pelvic muscle, or let's call it the external sphincter below the bladder. They've pulled that up and the bladder down to connect that to the base of the bladder. That really needs to heal well, right? So it's usually recommended just let that heal on its own. I mean, the muscle's going to be working a little bit anyways, just because it's always on. So it's probably best, as you mentioned, to maybe just let it heal. It's only 7 days, 10 days sometimes. And then the exercises can start immediately after the removal. Because any troubles, it seems, with the catheter sometimes can set people back. And that's one of the risk factors, right, for more prolonged incontinence would be trouble with the catheter or an increased catheter placement time period.
Well, this has really been informative, just solid gold information today for our listeners. As we are nearing the end of the show today, Dr. Kirages will be sticking around after the show to answer a few bonus questions for the upcoming Prostate Health Academy in regards to how to perform the exercises, and how often. For those interested in getting in on the Academy list to have access to this, just go to www.prostatehealthacademy.com and sign up. So Dr. Kirages, any final thoughts today for our listeners?
If someone listening is experiencing urinary incontinence post-prostatectomy, or let's say is nervous about it happening with a future surgery, just know that there are interventions available to help. Unfortunately, not all urologists believe in these interventions, but the research tells us and experience tells us that they can be highly effective. So be your own advocate and seek out a provider, which includes lots of providers perform pelvic floor exercises. I'm biased, with my specially trained physical therapy group and those that we work with to help out, but there's lots of opportunity to make changes in continence recovery. And, we're ready to help.
Well, I know I can speak for our listeners as well that we have really enjoyed having you on the podcast today. Really valuable information that you've shared, and that will really, I think, help empower men and their loved ones as they navigate their prostate cancer journey. So thank you again.
My pleasure. Thank you so much for the opportunity and being part of your show.
Thank you again for listening to the Prostate Health Podcast. We would love to have you join our podcast Facebook group at www.facebook.com/groups/Prostate Health Podcast, or just use the Facebook group search function and search for the Prostate Health Podcast and ask to join. We'll see you at the next episode.